Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about medication. There's a lot of controversy about using potentially addictive medication for people undergoing chronic pain management. There's also been a lot of controversy, a lot of posts online, a lot of news stories about people abusing or becoming addicted to prescription pain medications. This is a big problem. I don't think it's overwhelming by any means, but it definitely is a problem that needs to be addressed. According to the Institute of Medicine, there's over 100 million Americans living with chronic pain. Many of them are probably using opiate medications. Some research shows maybe as high as 90% of people undergoing chronic pain management receive opiates. Now, using a conservative, at least for me, 10% estimate, that means of these 100 million people, probably 10 million will be experiencing either medication abuse, dependency, pseudo-addiction, or addiction. Now, if you're watching this video on YouTube and want to learn more about this, or more about what pseudo-addiction is, please go to the link below and check out our latest Freedom from Suffering Now blog, where I give a lot more information than what's in this video. I believe it is possible to help people manage chronic pain and avoid suffering, and I believe there needs to be three major pieces in place: an effective medication management plan, and if someone is in recovery from another addictive disorder or is at high risk for an addictive disorder, there needs to be a recovery-friendly medication management plan in place. But that's not enough. All the best practice principles for chronic pain management state when people have pain for more than 6 months, they need to be using integrated multidisciplinary approaches with a strong cognitive behavioral focus. I also believe people need to be using more than just medication. They need to be using non-medication, or what we call non-pharmacological interventions. Some of the common ones for this might be biofeedback, acupuncture, chiropractic, STEM units, TENS units, meditation, relaxation response training. The list goes on and on and on. The bottom line is that people living with chronic pain may need to be on appropriate pain medication. It doesn't mean they're addicts. Some people get diagnosed by family and friends or even healthcare providers when it's really not addiction. It might be this phenomenon we call pseudo-addiction, which quite simply put is undertreated or mistreated chronic pain. If you want to learn more about medication dilemmas in recovery, on July 11th, I'm conducting a one-day workshop on this topic. It's in Sacramento, California on Saturday, July 11th. Registration's from 8 to 8:30, and the training is from 8:30 to 5 p.m. It's very experiential, and I really would like to see us have a really good turnout for this because it is such a hot topic. Please check back frequently as I update our Freedom from Suffering Now blogs frequently. Thank you for your attention.